Right, so with sciatic pain, sometimes it's not necessarily the nerves in the back getting compressed, but all these tight muscles around here that's going to pinch on that nerve, right?
Mm-hmm.
So if you have the corner of a table or a chair, somewhat, I find that kind of helpful to kind of just dig that in there into those tender spots there, and
Okay.
just gently use that as a pressure to push and stretch out that muscle in the tissue there, right? But aside from that, in a more gentle sense, it's just to stretch out those muscles. Sitting yourself with yourself cross-legged like this, gently pulling the foot up into the groin area and then up to lift the knee. So you can see that I'm quite tight to my hips right now, so my back's not exactly vertical. I'm kind of falling down, right?
Mm-hmm.
So you just drop your leg off the edge of the bench or the table to allow you to pull this up further. And now having the foot up into the crease of your hips here will allow you to cause a lot more rotation and stretching the hip socket a bit better. You got to be careful of the knee here, because when you're bending it, you're going to stretch the outside of your knee. If it's really tight, it's going to irritate that ligament there. The other thing you can do is start to tear your deep peroneal nerve on the outside of the knee here. Okay, you damage that, you're going to get numbness down the top of your foot. So yes, hold it as long as you can to give the body time to adapt and change and lengthen. But don't hold it so long that the tightness is going to cause damage and rip things. So it's kind of a fine line, right? And how you gauge by that is comfort. If you can relax, embrace the sensation, good. Hold it as long as you like. Once it starts to get uncomfortable and you feel yourself tense up, it's time to stop. Because anytime you cause tension, it causes conflict in the body and tissue is going to break. Another way to do that is just to lie down in this position here. Cross the leg apart, take the leg across the body. Now, the focus here is to keep the shoulder on the ground and let the knee touch the ground on the other side. I don't have quite the rotation right now, but as you sit here or lay here, your body's slowly going to melt, the tissue's going to lengthen, and it'll drop. That lengthening is kind of like callousing on the skin, right? As it lengthens, it takes that pressure off. And also with your nerves. We always have this sort of nervous, anxious apprehension and tension in the body. As you learn to relax, the nerves disengage, the muscles open up, you get more blood flow. Another good way to stretch is just having your legs nice and stretched long like this and just fold over, allowing you to lengthen out that hamstring. For the hamstring, also the deep muscles on the inside, if you are lying against a wall here in this way, you allow your legs to, just the weight of your legs to lengthen and stretch out the inside here. Okay, working up your back a little bit more, you can grab your feet, pull it up this way, just a little bit more effort onto the hamstrings. I do this underneath the dining table, so I don't have to use my hands, just use the bottom of the table to hold your leg in place. Okay, so now with your arms, you're getting numbness in there. Stretching and pulling your neck away will help lengthen out the connective tissue here. Just imagine you have a really tight shirt on. That tight shirt can choke you as well. But if you are pulling on it, you stretch out the fibers, you're going to create more space. The nerve is less irritated, you're going to have more comfort. Okay, dropping your wrist down, pulling your wrist back. All your muscles kind of spiral around your body. So when you want to find those tight spots, you got to roll it up and down a little bit and find where the restriction is. If it's uncomfortable, it's tight. Ideally, all your emotions are going to feel like sitting into an air ball. It should be gentle, soft, and comfortable. If it's not, there's restriction there causing the pain. And it's just gently releasing that restriction and stretching it out. And then once you have that looseness, you do some more conditioning to strengthen up your muscles to help stabilize that. And we'll go into that next time. So I have your email address.